I am Dr. Sridhar, graduated from All India Institute of Medical Sciences, New Delhi, and after that, I worked at Christian Medical College Hospital, Vellore, followed by St. John's Medical College Hospital, Bangalore, and ending up with Fortis Hospital, Bangalore. In this, I have a special interest and aptitude for diabetes, thyroid, calcium-related bone diseases. I have been given a task of talking about calcium disorder in clinical medicine and its role. When we talk about calcium disorder and its role, we want to know what exactly calcium plays in a normal individual or normal human being. Normally, calcium is an important element which is needed to strengthen our bone and keep us going comfortably. 85 to 90% of the calcium is in the bone itself. Therefore, people having bone diseases can have an associated calcium disorder and vice versa. Therefore, it is imperative that we always link up calcium problem with bone diseases. And this is something which I will devote as I proceed. Calcium basically plays a major role in making the bone very dense. When I say very dense, it becomes very thick, and once it is very thick, it is prevented from breaking down. As the age sets in, as the age comes in, this action of the bone comes down, and then the next action of the bone, which is replacement of the dense bone to a non-dense bone, which makes the bone very, very thin. And once it becomes very thin, they have a liability to develop fracture. In addition, calcium plays a very major role in cardiovascular problems, blood pressure regulatory problems, and related bone issues involving the tooth. Full stop. And once there is a calcium deficiency state, one can expect that these systems can also get affected and patient can get into problem. To alleviate that, one gives calcium with a view to improve the above problem and patient doesn't suffer from that. When we have calcium disorder, the disease is called as calcium deficiency state, medically osteomalacia. When we say osteomalacia, we mean total deficiency or partial deficiency of calcium, which makes the bone brittle, and when bone becomes brittle, it has a tendency to break. Biggest and common example is even a trivial fall a person can sustain and he can break the bone and sustain a fracture. Therefore, it becomes very essential for the treating doctor to understand this and talk to the patient when he is going to see him that please take care of your calcium status properly and well. This is what we mean by calcium disorder or osteomalacic disorder, meaning that the calcium status in the blood and the bone and the body is deficient. Need, having told the basic need of calcium for various functions, we can understand now lack of calcium can produce quite a few symptoms which are otherwise called as quite a few symptoms. And what are they? The quite a few symptoms and complications and problems are patients having low calcium get tingling, numbness and a peculiar sensation on the feet, on the fingers. This is one of the very early feature of calcium deficiency state, and this is something which a doctor in the periphery, or for that matter even a normal individual in the periphery, should be able to understand, appreciate, and once he sees that, his immediate role is to bring it to the attention of the attending doctor and say that this is something going on and it is possible the patient has got a calcium deficiency, please look after it. This is one of the common way in which persons with calcium deficiency present. The next way in which persons with calcium deficiency present is unexplainable bone pain, muscle pain, and inability to walk properly. And for no reason, a patient or an individual develops bone pain, muscle pain, one thinks of calcium deficiency state, refers the case to the doctor and corrects it if it is there. It is a very, very common problem in one's practice. Subsequently, calcium deficiency state or hypocalcemia, which we call it medically, can lead to some of the menstrual irregularities and problem in the genitourinary system. And women having a problem concerning with the genitourinary system should also keep in mind that this could be due to calcium deficiency state and be aware of it and take corrective measures accordingly. Thus, I have enumerated few fundamental ways in which calcium deficiency state can present in one's practice. Of course, we have already mentioned the role of calcium in bone maintenance or otherwise called as bone homeostasis. And if the calcium deficiency is there, bone becomes painful, and if this is not treated, bone can become fractured, and once a bone fracture sets in, it is a long-term treatment, long-term problem. When we say calcium deficiency disorder, we have to understand very basically what we mean by it. Calcium in the bone is looked after by two types of cells. One is osteoblasts, which make the bone very thick and solid, thereby bones are prevented from breaking down and becoming brittle. This is osteoblast. Osteoclast is a situation where the bone gets eaten up by various situations, various disorders, and once the bone gets eaten up by the disorders, calcium drops in the blood and in the body, and the individual breaks the bone. So there is a joint combined effect of osteomalacia due to a combined effect of osteoblasts forming new bone formation, osteoclast breaking the new bone formation, producing the disease. In clinical practice, we would like to avoid osteoclastic reaction as far as possible and make the bone more dense by creating osteoblastic reaction. Now I will be dealing with calcium excess state. When a patient is suffering from calcium excess state, calcium disorder, which is otherwise called as hypercalcemia, they usually come with upper abdominal pain, which is very severe and very excruciating. Along with this pain, they can have vomiting, and at times, depending upon the vomiting and pain, they can have bleeding from the gut also. That is upper abdominal pain. The next is they can have pain in the kidney area, urinary bladder area, which is because of the renal calculus disease. Excessive calcium produces renal stones, and one of the most important way in which renal stone disease presents in clinical practice is abdominal pain, which is not upper abdominal pain, which is a lower abdominal pain because kidney is in the lower abdomen. That is kidney presentation. And the next is patients with hypercalcemia can have groaning, mental disturbance, getting upset, mentally agitated, various types of mental agitation they can have. If you see that, keep in mind that this could be because of high calcium state. Thus, I have talked about abdominal pain due to the ulcer, abdominal pain due to the stone, groaning and moaning because of its involvement of the central nervous system and affecting the brain. By practice, patient with calcium disorder, in particular calcium deficiency state, usually and almost 95% of instances come with extreme degree of muscular weakness, comma, unable to walk properly. Number 3, walk with a waddling gait. Whenever I see this sitting in my room, I should be able to think that this person may be having a calcium deficiency state, and to this effect I carry out the investigations and see what is going on. At times I see a patient with calcium excess state where they come with severe abdominal pain connected with a renal disease, kidney, bladder. So this is called as calculus disease, because renal calculus is one of the complications of hypercalcemia, and once they have got a calculus disease, you think of high calcium state. This is also something which I have seen in clinical practice, and usually we are able to think correctly and carry out the necessary investigation and treatment. Therefore, if in your day-to-day life you have complaints such as muscular pain, muscular weakness, inability to walk properly, and walking with difficulty in gait, and painful walking, please think that you could be having a calcium disorder and seek a medical opinion.